So it was quite nice actually to kind of get this title of Bridging the Knowledge Gap to Better Kidney Care, because it's quite a broad church. It sort of gave me a little bit of a soapbox to kind of talk about things that are, I think, really important to me, and I hope I don't apologize for perhaps concentrating on some of the topics that are important to me, because I'll talk to you, I hope, with a degree of enthusiasm that will connect with you. And I hope actually that those things that are important to me as a doctor who helps to look after people with kidney disease, and a researcher into those areas of kidney disease that I find interesting and important, and share those priorities and that enthusiasm with others on the call. So I don't apologize to that, and I hope that you will enjoy the talk and find a lot of those things resonate with you as well. So the first thing I'm going to do is ask you to take your phones out and point your camera at that QR code if you're familiar with doing such things. You could also, if you're on a PC, you can open up a web browser and go to slido.com, and it will ask for a code which you can put in, and that's the code to put in. And so while you're kind of, and sitting waiting for you is a question about two conditions that I am sure you will be well aware of. And I'm going to ask you to vote and tell me which condition you think is more common. And for those of you that aren't using Slido, you can still register or at least think about which one you would believe to be more common. And the two conditions are kidney disease, not surprisingly, and diabetes. Okay, so which of those two conditions is more common, kidney disease or diabetes? And when you've finished, don't close the Slido down, because there's a couple more questions that I'm going to pose to you as we go through the talk, just to make sure it's not a test. So please, it doesn't matter if you go off and make a cup of tea or, miss a bit. It's not a test. It's just thinking about your reflections. Okay, so thank you to those that have voted. It's a little bit of a kind of rhetorical question, I guess, given the topic of today's talk, which is about kidney disease and bridging that gap. And I'm a kidney doctor, and so unsurprisingly, you will, well, I'm not going to spoil the reveal. So let's go and think about that. So just how common is kidney disease? And the answer is it's more common than you might think. We're going to talk about the implications of that a little bit as we move through the slides. But you might be surprised to know that actually more than 1 in 10 people globally have kidney disease. And it'd be interesting, perhaps when we pick up on the questions, whether that was a surprise for you to hear that, or whether perhaps the other way, you weren't as sure, you thought maybe more people would have. But certainly around 1 in 10 people globally, more than 1 in 10 people globally have kidney disease. But if you compare that to diabetes globally, it's actually slightly less common, and that the prevalence of diabetes is around 1 in 11 people, so less than 1 in 10. So actually, when we look at those global figures, kidney disease, we should be thinking at least on a par, but actually it's at least as common, if not more common, than diabetes. So to the 82% of you that said chronic kidney disease on that poll, that's fantastic. But again, for those of you that thought diabetes, not a big surprise that you thought that, because I think a lot of people would be in exactly the same situation as you, thinking that diabetes was more common. So what does that mean? And we wanted to talk a little bit about the burden of kidney disease to individuals, to society, and some of these numbers, and I want to try and put them into context a little bit as well, because, in terms of what that costs to the NHS, it's a lot of money, £1.5 billion. In fact, that's such a big number. You might think, well, how do we contextualize that? Because it's still actually a lot less than other medical conditions. And I read an article in the Daily Mail once that said we spend 4 billion a year on packaged sandwiches for lunch. And so whilst that is still a lot of money, it's interesting perhaps to reflect that to society, kidney disease is half as important as the packaged sandwiches that we get from whichever retailer that might be in our lunch deal for our lunch. And the consequence of that burden of kidney disease is that it has an impact. It has an impact on symptoms, it has an impact on day-to-day, which we'll talk about, but it also has a real impact on quality of life and quantity of life, contributing, they estimate, to around 45,000 premature deaths each year, and a lot of association with admissions to hospital and longer stays in hospital once you're there. So I guess that's not a surprise. But why have I put this slide up? Other than I think it looks pretty cool. But some of you will be familiar with this concept of the illness iceberg. You might have heard of that idea that what we see is just the tip. What is known about, what is there, what is visible is just the tip. And underneath the surface is a much bigger problem waiting to cause an awful lot of heartache. And the reason that I show that slide particularly is again to put this number into context. And there's a couple of really great points that come out from this slide. And the first is to see what we're expecting to happen over the next 10 years in terms of the number of people who have a diagnosis of chronic kidney disease. And what you can see there in the dark purple is that over the next 10 years, by 2030, we're expected an increase, a considerable increase in the number of people with chronic kidney disease who are diagnosed to have that, nearly 500,000 extra individuals with chronic kidney disease. And in terms of the total number, that means that we're going from around 3.5 million to nearly 4 million people in the UK with kidney disease. But more striking to me is the number of people sitting in that light purple box. That increase in number of individuals who've got kidney disease and have no idea that they're walking around with potential damage to their kidneys and all of the implications that having a chronic disease goes with it. And we focused an awful lot, quite rightly, on detection of other conditions, screening for diabetes, screening for high blood pressure. One of the first things I think we would all expect as we walk through the door to see our GP or the nurse at our practice is that we would have our blood pressure checked. You know, if you go to Asda, you go to Boots, you know that you can get a screen for diabetes, you can get your blood pressure checked, because we know how important it is to detect people with a potential underlying condition that they don't know about. But we don't do that for kidney disease, even though we can see that the trends for kidney disease map just as they would for those with diabetes. And I think we're a little bit behind the curve on that. And again, I think that would be a really interesting conversation to have towards the end, if people want to have a chat about that. And so, you know, my kids often say to me, well, so what, don't forget to do this. You need to have breakfast. If you don't have breakfast, well, so what if I don't do this or I don't do that? Well, you could ask the same question about detecting kidney disease. So what does it matter in the long term? Is it really important? And we're going to talk a little bit more about that as we go through. But one of the things that we know is that kidney disease is progressive, and that the final part of that pathway is kidney replacement therapy. And that might be a kidney transplant, it might be dialysis. But there is no doubt, just in the same way that we can see that the number of people suffering from chronic kidney disease is on the rise, that over time the number of people that we would expect to need kidney replacement therapy, either in the form of a kidney transplant or on dialysis, is going up. And that's exactly what this graph shows, that over time, the numbers have gone up, and that is predicted to continue well past 2030. And part of that is because countries in the developing world kidney replacement therapy is becoming more available to people. But actually, if you look at that graph on the right-hand side, you can actually see that it's also true, the green bars in Europe and and North America, the more developed countries. So it's absolutely right to say that one of the consequences of the increase in chronic kidney disease is going to be an increase in the number of people who are going to need dialysis or a kidney transplant. So look, this is the question that we're thinking about today. How can we bridge that gap to better kidney care? So this is the next question. I'm going to ask you to, again, log back in again. I'm going to absolutely double check that I've just made that poll available. So the next question is, according to a survey, what percentage of the UK population know that their kidneys make urine? Okay. So what percentage of the UK population know that the kidneys make urine? Okay. And people are already voting. That's great. For those of you that can't see it, I've basically put it into quarters. So there's a 0, a 25%, a 50, a 75, and 100%. And I can see that for the majority, there was a phrase that I learned when I was doing exams, which was never say never or always. So if the answer is never or always, it's going to be, that's the wrong one. So I can see that most people are absolutely going for the numbers in the middle. Somebody's just changed their answer from 100 to something else, which is absolutely fine. So, and the answer to that, I will let you out of your misery. Let me just get my slides back up again. The answer to that is that only around 50% of the UK population know that the kidneys make urine. And the actual answer is 51%. And so most of you were absolutely spot on with that. But I think actually everybody appreciated that it's a smaller number than perhaps we would expect. And with everybody on the call being interested in kidney disease, it's a number that some of us might be sad about, a little bit disappointed about. So the question, though, again, is, so why is that important? Does it really matter? Because I'm sure if we were talking about heart disease, I could do a similar thing about, the number of people that know a particular thing about what the heart does, for example. So why is it that I've picked out that statistic? Because it's not just that it's interesting or perhaps sensational, but it is important to think about that. So here's one particular thing that I've picked out, okay? And this was a study of outpatients in a big hospital. It's appointments actually between 2015 and 2016 in a big hospital of 2.5 million outpatient appointments in the adult outpatient department, okay? And what you can see in that pie chart is the percentage of those appointments that are offered by each of those specialities. So the first thing that you can see, despite what some of us might think, is that cardiologists actually work really hard and would see around 20% of all of the outpatients is in cardiology departments. And right up there, I don't know if you can see it, sitting at the top left is the nephrology department or renal medicine department. And so in that particular hospital, and it wasn't a UK study, so it will be slightly different, but you can just see it goes to show that our outpatient workload is much smaller compared to some other departments like diabetes, cardiology, and so on. And then what you've got in that table there are the number of appointments, first appointments, okay, so new patient appointments to that speciality. They're the ones who didn't show up. And interestingly, of all of those popular or busy departments, nephrology had the highest non-attendance rate for first patient appointments. So what does that mean? That means to me that for whatever reason, people are less engaged with the health of their kidneys or appreciate less the importance of the health of their kidneys to things more broadly. And I think that's actually really important. And again, you might find that a surprise. You might find that saddening. And here's another. So the question I then thought is, well, is it because people just don't know that they've got a kidney problem? So here's another study, and I think this shows this really nicely, because so I was in my new patient referral clinic last Tuesday. I saw around 10 new referrals from general practice. And the first thing that I always ask when people come to that particular clinic is, tell me what your understanding is about why you've come to the kidney clinic today. And maybe not as many as a half, but certainly a third of all of the people will just say, well, I don't know. My doctor just said that I should come. And sometimes they don't even know that the referral had been made. So is part of the problem that people don't know they have kidney problems in the first place? Okay, so what I'm showing you in this particular slide are data from the US National Center for Health Statistics. And what they do is they do a cross-sectional analysis of US citizens. They go out and they visit people's homes, they do surveys and take blood tests and do interviews to try and get a feeling of health in the United States. Okay, so this particular study looked at almost 2,000 people, okay, who were found to have kidney disease, to understand whether or not they knew about it. Okay. And what's interesting about this is that all of these individuals, these 2,000 people, had seen a doctor within the year before that. So there was definitely an opportunity to be had to help people understand that they had kidney disease and what the implications of that was. And what you can see here is that, so it says there, the number of abnormal clinical markers of kidney disease. So these 2,000 people had evidence of problems with their blood results. That might be their kidney function or their potassium level. It might be that they had really high blood pressure or that they were leaking some protein in their urine. So they definitely had a marker of kidney disease. And even those that had 5 to 7 markers, so the full house of all of the things that they tested, 85% of those people had no idea that they had kidney disease. And if you had less markers of kidney disease, back down to just perhaps one of those, an abnormal blood or urine test, 94% of those people didn't know that they had anything wrong with their kidneys, even though they'd seen a doctor in the 12 months before that. And so is it a surprise then that people aren't necessarily that engaged with turning up to their clinic if they're referred to a specialist because they don't know they've got kidney disease, they don't understand the implication of that? And I think that is something for us to reflect upon and think about. And the conclusion of that paper was that despite efforts to increase the awareness, individuals often remain unaware of their disease. And as a marker of increased risk of problems with their heart and an increased risk of early death or mortality, that, we're not very good at incorporating routine communication and information about kidney disease into the way that we communicate from hospital and from healthcare with people with kidney disease. Okay, so here's my first tip then, that one of the ways that we can bridge the gap to better kidney care is to help people understand more about the importance of their kidney disease and what that means in the short and long term. Okay, so that's the first little reflection from me. And so the second thing then is thinking, well, okay, so we might classify someone as having a problem with their kidneys, but is it important to do that? And I remember when estimated GFR was first reported, and my wife, who's a GP, and she was saying, well, I didn't ask for that test. I didn't ask for an estimated GFR. Lots of GPs were saying we don't really know how to interpret that result. And it means that an awful lot of people are getting a label of having a chronic disease, is that the right thing to do? Should we believe, I've put there the hype about all of this stuff around kidney disease and the importance of it? Well, as you can see from the date, that was back in 2013. And I think we really now appreciate that absolutely we should be believing the hype, and that helping people to understand the importance of kidney disease helps to think about risk of other problems like heart disease and stroke. And this might look a little bit complicated, but actually, if I just talk you through it, what you can see is when you look at the risk of dying from any cause when you've got problems with your kidneys, and you can see their normal kidney function would be an estimated GFR or estimated kidney function around 90, that as your kidney function goes down, so unusually we're looking from right to left, that as kidney function goes down, if you can see those lines going up, that your risk of early death from any cause, not just kidney disease, goes up not one, not two, but nearly threefold once your kidney function is down to 30. And more than that, you can see on the graph on the right that as your kidney function goes down, that someone's risk of dying from a problem with their heart goes up even higher than that, to when you're down to a level of 30, that risk is fourfold or even higher. And I think that's really, I'm sure that many of you are well aware of that, but nevertheless, seeing it is perhaps very striking. So here's an image from World Kidney Day over 10 years ago, actually, and we've known for a long time and well understood that actually protecting our kidneys is one of the really important ways of looking after our hearts. So why else does it matter? Okay, why does it really matter about things that are important to people with kidney disease? Of course, thinking about living a long life and living a healthy life, looking after our hearts, that is really, really important. But let's not distract from the other things that are really important, and that is how people feel on a day-to-day basis. Okay, so this is a really, really powerful slide in my mind, and this represents perhaps people on the more advanced spectrum of kidney disease. But when I talk to people who I help to look after about the things that get them down the most, and we know from lots and lots of surveys and studies that fatigue and restlessness and tiredness and problems with sleep are really common in people with kidney disease, itchy skin, and they are the things that often people find most intrusive in their day-to-day life. And what you might not be as aware of is that actually people with CKD, with kidney disease, have an average of 6 to 20 symptoms dependent on how advanced their kidney disease is. And that has a real impact on day-to-day life, actually. And as a doctor, I need to remind myself not to just think about blood pressure and heart disease and all of those things and medications, but also to ask people, how are you feeling? What are your symptoms? How is that impacting on your day-to-day life? Because when you look to see some of those things that are common and really important, so they're fatigue, look at that, 80% of people with kidney disease who were surveyed in these studies were complaining of fatigue, and nearly a half of those said that level of fatigue bothered them very much or quite a lot. And so for the people who work in healthcare who are on the call today, I just, again, if you're not incorporating questions about those symptoms in your day-to-day practice, then maybe, and I'm just as guilty of that as anybody else when I'm pushed for time, then we need to be thinking about that. And if you're somebody who has kidney disease and those things are bothering you, please make sure that you're bringing those things up, because the other thing that we know for things like itch, for example, is that 18% of people on dialysis who suffer from itch don't mention that symptom to anybody because they don't think that there's very much that can be done about it. And so we don't ask, and neither do people tell, and that doesn't help with the burden of those symptoms. Okay, so I told you it'd be a bit of a soapbox moment for me as well. And I absolutely love this slide because I think, again, this shows the impact of kidney disease on day-to-day life for people who have kidney disease. And so You might, if I were giving this talk to medical students, of course, I would be highlighting those light purple boxes, which is that as your kidney function declines, again, we're going from right to left, you can see the purple bar gets higher and higher as people are more likely to have problems with their blood pressure as their kidney function goes down. But I want you to look at the gold bars, because the gold bars tell us what happens to people's day-to-day again. It's about someone's ability, or rather here inability, to walk a quarter of a mile, independent of all of the other things that are going on. This is because of their kidney disease. And you can see what happens to the impact it has on someone's day-to-day ability to get out and walk as kidney function declines. And you can see that as many as 25% of people are unable to walk a quarter of a mile if their kidney function has dipped below 30%. And Tom Wilkinson, who's on the call, and it's a pleasure to see Tom joining us. So I'm going to name check Tom because this is one of Tom's papers. And so I feel a little bit guilty that I'm telling Tom about data that is his to share. But nevertheless, this is a really, really striking illustration of just what happens to physical activity levels as your stage of kidney disease goes up. This was a survey of more than 5,500 people with kidney disease, and just highlights really well that the worse your kidney disease, the less physically active that people tend to be. And there is a knock-on with that. And that might be even around things like muscle. And again, this is a slide given to me by one of our researchers called Emma Watson, who looks at research around muscle strength and function and what can happen to muscle in people with kidney disease. And a picture paints 1,000 words. So there is a cross section through an MRI scan of someone's thigh. And on the left, you can see a healthy person and just how much of that healthy muscle is there. And on the right-hand side, you can see a person who is matched for everything other than their kidney disease and the impact that kidney disease has on someone's muscle. And so it's not a surprise, therefore, that that's going to have a real impact on someone's ability to function and walk and take part in physical activity and exercise. Okay, so there we go. Here's my next little reflection, which is when we're bridging the gap to better kidney care, we've got to think and help people to understand the impact of their kidney disease. And that's not just for people with kidney disease, but also for us as practitioners or researchers to think about that as well. Now, moving on to think a little bit more about what we could do in the health profession. Okay, so here is data from, it's about 10 years ago, but this is Leicestershire data on each practice's individual record of people with kidney disease. Okay, so at the beginning, we said that the prevalence or the number of people with kidney disease in the general population is somewhere around 8 to 10%. It's a bit less than 10% in the UK, but it's definitely somewhere between 8 and 10%. But if you go to a GP surgery and look at their register of people with kidney disease, the average number would come out at around 4%. And that isn't because Leicestershire's got less people with kidney disease, it's because they're around and about, but not on that register. And we talked about the implications of that around the illness iceberg. But let me expand on that a little bit. Okay, because if we have identified those people early, then we've got an opportunity to intervene on their disease a little bit early as well. And this is an absolutely great illustration of this. And this, again, this is a piece of work from Sheffield. It's a little bit older now. It's 10 years old, but again, it illustrates the point really well, even though treatment has moved on a little bit, what we can do if we identify things earlier. Okay, so this is looking at identifying people early. So it's a group in Sheffield, and they went out and they found almost 500 people who didn't know that they had kidney disease, and they treated them optimally with the medications and the interventions and all the things about diet and lifestyle and exercise at the time and management of their blood pressure and diabetes. And they did that optimally over 5 years. And they estimated that in that population of about 500 people, they'd saved 9 heart attacks, 2 strokes, and in the long term, 97 years of dialysis. Okay, that's a bit difficult to kind of get our heads around, but essentially what they're saying is by managing people really, really well, they're delaying the start of dialysis to such an extent that they're saving a huge number of years of dialysis. Okay, and you can see below that that is a significant number of lives saved early and a big saving to the NHS. Okay, so it's a World Cup year, so I thought I'd get that picture of Gareth Southgate in. We're all rooting for you, Gareth. Okay, so if you apply that to the GP practices in Leicestershire, okay, so an average GP practice in Leicester's, let's say they've got 7,000 patients, 5% of those patients have got CKD, but they're not on the register, okay? So that equates to about 350 people in your average GP practice. So if you take that data or those data from Sheffield and move it across to an average GP practice near where you live and apply that same kind of strategy of managing people optimally, giving them all of the best advice, then that could potentially save 7 heart attacks, a stroke, a number of premature deaths, and a significant economic impact on the NHS as a whole. That's just, again, food for thought. So when we're thinking about that gap, I think we need to, think about the way that we can help in terms of healthcare systems to better understand the impact of detecting kidney disease and how we can support primary care in delivering optimal care. Okay, so I've got about 5 or 10 minutes left. And the other thing I wanted to talk about was the amount of research that we do in kidney disease. Okay, and it's a lot less than other diseases. So here is a really interesting graph. And this shows the number of publications of research studies between 1966, when the registers first came out, and 2001. Okay. And the green line with the green squares at the very bottom is the number of published studies in kidney disease. And I want you to have a little look at those 2 lines at the top, which is cardiovascular disease in the light blue and gastrointestinal health in the dark green without the bars. And I tried very hard to make my circle look like a different color or shape, so it wouldn't just look like I'd added in another bar. But I hope you can see what I'm trying to get out there. I just want you to pick out the number of studies published in cardiology at that time. And why have I asked you particularly to concentrate on that? And it's because that is a fantastic success story. So when we look at what happened to death from heart attacks and cardiovascular disease in the UK over that time, this is an enormous success story. And I saw Chris Whitty present this at a talk to remember a colleague of ours called Donal O'Donoghue, who died sadly from COVID. And he was really highlighting this as an area that we should be really thinking about, but it has direct relevance to kidney disease. Because in the last 45 years, the number of deaths attributed to heart and circulatory disorders has declined by 75%. And that is with the advent of, a greater understanding about the use of drugs like aspirin, a greater understanding and a greater number of drugs around lipid control, and also the way in which we manage heart disease, medications, but also now you go straight to the catheter lab and hopefully if you had a blockage in an artery, you would get that cleared with an injection of medication and a stent. So we've really revolutionized the way that we've managed heart disease, and we've reduced the number of deaths by 3/4, which is a fantastic success story. So here's a small digression. Okay, so here's the fact sheet that came from. Look at that. Here's the British Heart Foundation fact sheet, the most up to date. Look at that. They're highlighting the importance of diabetes in that. They're highlighting the importance of obesity and lifestyle and diet and exercise. And just look at this. There's kidney disease right down at the bottom. It doesn't even get anything more than a footnote, even though we know it's as common as diabetes, and that the majority of people with kidney disease actually will have a complication or die from their heart disease, not from their kidneys. I think it's upon all of that to just be kind of, trying to move kidney health into the public arena a little bit more. But let's go back to those two graphs. So look how those map onto one another, because the years are almost the same. So there we are from the early 1960s, the number of studies absolutely skyrocketing around cardiology. And look at that, the number of deaths from cardiovascular disease attributed to heart attack plummeting as I'm overstating it, maybe not as a direct response, but you can see an association with that. So back to Slido. Let's see, here's my last question. And let me just put the last question up. Okay, so in 2018, which area of healthcare had most investment in research in the UK? And I've put down 4 options there: cancer research, heart disease, kidney disease, or stroke. And they're in alphabetical order, so I've not put those in any particular order. So have a guess and see what you think about that. The area that had most investment in research. So thank you to everybody who's put that in. You're absolutely spot on. Around 85% of people saying cancer research, it's going a little bit more now. It's changing a little bit, but again, reflecting exactly what we would be seeing. And I will show you the answer to that, which is in 2018, £483 million worth of investment into cancer research. That's about 20%. So for every £5 given to research, about £1 of that goes to cancer research. Cardiovascular disease, around 156 million. That's around 6%. Stroke is perhaps a bit more surprising, just over 1% at 30 million. And kidney disease, 25 million. That's 1% of the total investment into health research. Now, I'm not saying that this is right or wrong, and cancer research is incredibly important, but I guess it's just a reflection that of every £5 invested in health research in the UK, £1 goes to cancer research and 5p goes to kidney research. And so if we want to see improvements in outcomes for people with kidney disease, like we've seen over the last 40 years for people with heart disease, then I think we would all agree that we probably need some more investment. And why is that important? Because, so this is a slide that shows just how difficult it is to be a person on dialysis living with kidney failure, especially if you've got diabetes, and that actually the outcomes are similar in terms of 5-year survival as some types of cancer. And what's worrying about this is their data from 2011. Here are the data from 2019, so much more up to date. And I guess what I wanted to show you from this slide, which is a bit busier, is at the top you can see in green for men and women, men on the left and women on the right, that the only thing still worse than outcomes for people on dialysis are those 2 types of cancer there put down as lung and pancreas. But more importantly, when you look at the outcomes over time for those kinds of cancer versus dialysis, all of them are showing improvements in outcomes, just like for heart disease, except I guess you can see that light green line, which is improvements in outcome in terms of survival for those individuals on dialysis, which have remained pretty static over the last 20 years. And I think we just need to really consider, and this is my last reflection, that if we really want to improve outcomes for people with kidney disease, we've got to think more about investment into research. This is a talk for the National Centre for Sport and Exercise Medicine, so my last couple of slides are just a reflection about the importance of being active. Exercise and being physically active can impact in so many positive ways. and this slide represents that really nicely. It doesn't matter whether it is your heart or your lungs, whether that is at a cellular level or bigger than that, or whether it's working on the muscles that we looked at earlier and reducing inflammation in the body by building up our muscle mass. Exercise is really great. And if we've got an opportunity to really highlight that to people, it is absolutely great. We've been living through a pandemic, and that's had a big impact on what we do day to day. And again, just so here is a survey of lifestyle and physical activity through Sport England. Obviously, this is people who are going to be more active. We're not thinking that the people that we see with kidney disease are going to be doing 150 minutes of physical activity a week. But I guess for me, the reflection of this is, as somebody who used that opportunity to get out and do a little bit more exercise during lockdown, I even did the couch to 5K, that actually that is not what was happening nationally. That physical activity and participation in exercise went down during lockdown, and all of the physical and psychological consequences of that. And so again, my reflection, and the reason I highlight that, is if you've got an opportunity just to reinforce to people how important physical activity is, then we should be taking that. So just to summarize, and then we've got 15 minutes to sort of have a few questions if people want to do that. Let's remember kidney disease is common. Lots of people do not know that they have an underlying diagnosis of kidney disease, or that there's anything wrong with their kidneys, and we should be thinking about ways to tackle that. Thinking about better care, well, better understanding of the diagnosis to help people to engage with all kinds of things, from physical activity to thinking about compliance with medication and so on. Understanding the potential impact over time, supporting primary care in delivering great kidney care to people with kidney disease, and better funding for research. So that, you might be pleased to hear, is my last slide. I'm going to stop sharing there, and perhaps we'll go back to any questions.
That's fantastic. Thank you very much, James. Really appreciate what you've done for us. Hopefully we'll have a few questions in the chat, or alternatively, people can put their hands up under reactions and we'll get a few questions. As you say, we've got another 15 minutes or so before the end. Really interesting. Thank you. I've learned more than I have before, so I shall be going and looking after my kidneys a lot more now.
Good. Well, and thanks to Anne-Marie for the clapping emoji. I know what all of these emojis are now. I've got teenage children. But if you do want to, even a reflection or a question, a comment, it doesn't have to be a question. It can be a reflection or just a comment. Either pop it in the chat or feel free to put your hand up. You don't have to turn your camera off if you're particularly shy, or you've got chaos going around behind you at home, or you're just having a glass of wine. All of those things are absolutely fine. There is a hand, and it is from CAB.
Hi. Couple of questions. Chronic kidney disease, is it just one disease, or is that covering a whole range of diseases?
So that is a great question. And that goes back to, I think, one of the things that I mentioned earlier, which is, so let me answer that first. So chronic kidney disease in effect is a label that helps us to understand someone's risk of other problems. And actually, it can be caused by a number of things. So the commonest cause in the UK would be diabetes, closely followed by high blood pressure, and those things are not intrinsically diseases of the kidney. It's that the kidney is the innocent bystander of that. But what defining chronic kidney disease helps us to do is to think about someone's risk of developing complications in the future. And that might be the risk of their kidney function deteriorating a little bit more, or it might be the risk of having some problems with their heart or stroke in the future. So it isn't a disease in itself, it's more of a classification that helps us to understand the complications that people might have in the future. And it's caused by any number of different things, if that makes sense.
Yeah. The reason I asked was that things like diabetes, then you get a warning that your BMI is getting too high.
Yeah.
You're heading towards being obese. Yeah. You're liable to end up with diabetes, but it's at that point it's reversible.
Yeah.
What you don't hear are things like, this is how to look after your kidney. This, other than there's the sort of generic 5 a day and exercise.
Yeah.
But are there any lifestyle changes that specifically help the kidney?
Yes, so that is a fantastic question. I'm going to come to 2 of those things, and now people are starting to ping things in, so that's also great. But I think you've raised a couple of really important points. There are things that we can do. Being physically active is really important. Obesity itself can contribute to problems with the kidneys, and so being active and having a healthy lifestyle, a balanced diet, making sure you drink lots of fluids, all of those things are really important to general health and definitely to the kidneys. What I do want to say is that I don't want to come across as all doom and gloom, because actually there are a number of new therapies that are coming onto the market at the moment, which really are a step change in the way that we're going to manage kidney disease. And, it's upon people like me and those working in hospitals to make sure that we really, bang the drum about those new therapies. And also that we're picking, and they work early on in disease. So it's really important that we pick up on some of the signs of kidney disease much, much earlier. I would love that every time someone walks into a GP surgery, it's as much second nature to dip the urine and do a urine specimen as it is to take someone's blood pressure. And I think that's going to be really key to thinking about the health of kidneys and to the heart in the long term. I hope that's answered that question. I hope that, that answers that. I'm going to move on to a couple of others though, if that's all right. So one of them is around bridging the gap for research so that kidney disease is comparable to that of other diseases. I don't have the answer to that. And one of the things that I do as a researcher into kidney disease is I'm always chipping away, trying to, put our ideas forward for new research ideas. I think from a researcher point of view, what we've probably been a little bit behind is our expertise in designing studies that are really important and really answer the question well. But I think we're getting very much better at that. And so rather than doing small studies that answer important but small questions, we're much better now at answering big questions that are going to have a really big impact. But I think what we then need to do is to be bolder and more ambitious in terms of where we go to ask for funding. And I think we've just got to make sure that, it's on the priority of the Department of Health and really big funders to think about kidney disease. But that there's only so much to go around. And I think, we have to be mindful that other diseases, cancer research, heart disease, they are still really important to the health economy and to people. And we need to think about where our place is, but maybe come up with really impactful ideas. But unless somebody's got a very big pot, then that's going to be a slow change. Somebody has said, so this is from Judy, you mentioned wine. How important is it to drink wine? Not to drink too much wine. Sorry there, Judy. So that's a really good question. And there was a really interesting, same survey as that survey that identified that only 51% of people understood that the kidneys make urine, but a lot of people also thought that drinking too much alcohol would have a direct impact on kidney health. Now, I'm not saying that it's fine from a kidney point of view to drink as much as you like. We should be absolutely paying attention to the chief medical officer's recommendations around alcohol intake. but sticking to that is not going to have an impact on kidney health. Obviously, it's got other things around health in general, and sometimes alcohol can interact with medications and all those sorts of things. But actually, I'm not going to sit here and tell you that your glass of red wine a day is going to have a negative impact on your kidneys, because that wouldn't necessarily be true. So from Nicola, I don't know if Judy wanted to come back to that, or whether anybody, but yeah.
Judy said thank you.
Great. So there's one from Nicola that says, insightful presentation, thank you. The importance of exercise. In the ambulance service, we mentioned to patients about the importance of drinking water and staying hydrated. Is this more or less a contributing factor than physical activity in contributing to kidney disease? Yeah, that's a great question. And I think they're both important, but you've got to choose your moment. And I guess it's a bit like some people say, oh, you know, when I see people in kidney clinic, you know, we want to talk to them about their diet, but also we want to make sure they're taking their tablets okay, and we want to make sure that they're being physically active. And we need to make sure that we don't throw too much at people all in one go. And I guess, so both of those are important, but you may choose to highlight one that you feel for that individual in front of you is going to hit the spot and engage them. So for some, it might be that, you know, all they do is drink fizzy drinks and coffee all day long. And you're saying, well, do you know what? Maybe you should be thinking about increasing the intake of water, and that's going to make you feel much better, and make you feeling hydrated is going to make you feel much more healthy, because that might be less of a step to start with than telling people to engage in more physical activity. And you might have somebody in whom the flip side is true. So tailoring your advice to that person in front of you is really important. Not overloading somebody with information that they just feel too overwhelmed that they end up actually not doing any of it is also really important. But in terms of which one is more or less, I think both of those are really important. Is it too early to start watching your diet, e.g. reducing potassium? Thank you for being honest about that. You've got kidney disease, and I've been told that I don't need to do anything yet. Surely it can't do any more harm to start now. I love that enthusiasm, but I genuinely would agree with that advice that you don't need to start doing anything specific. At CKD stage 3, your kidneys are still very capable of handling potassium and hydrogen ions, which might contribute to you feeling unwell. And actually, if you restricted your diet in other ways to restrict potassium, cutting down on citrus fruits, for example, you might actually then be limiting your intake of fruit and veg, or doing something else. So at the moment, I would not say that you need to start limiting. Have a healthy, balanced diet with a good intake of fluids. And I think at your stage, that would be the best thing for you. Patients, that is a fantastic question, and the answer is it's multifactorial. And whilst I kind of showed a headline grabbing picture, there isn't any one thing that's going to be causing that. But what we do know is it is that multifactorial kind of constellation of things that happen in people with kidney disease that make it more pronounced in those individuals with kidney disease. So whether it is that physical inactivity, or whether it is your blood results that you've got a more acidic environment, or whether it is the underlying disease processes itself, it's going to be different for individuals. But overall, kidney disease does have an impact on muscle health. And one way of breaking out of that cycle is doing more physical activity. What's the relevance of anemia and disease progression, please? Wow. What, have we got another hour? No, I've got about one more minute. And the relevance of anemia and disease progression is less clear. But what we do know, and what we know is actually correcting anemia back to normal levels doesn't help with disease progression or delaying it, and can be associated with more problems actually, but it does make people feel better. And it can have an impact on those symptoms that are really, really important to people with kidney disease. And I'm particularly thinking about fatigue, which is really, really common. So it's very important that we pick up on anemia, that we manage it well to have an impact on those symptoms like fatigue and tiredness. But in terms of disease progression, it probably is less important in that respect. There's a whole separate question around iron, because iron is part of the treatment of anemia, but we also know from some of the studies in the cardiology literature and heart failure that iron is important beyond anemia management. And so it might be that irrespective of anemia, that we're giving iron more routinely to people with kidney disease, but watch that space. There are various types of specialist one can see with kidneys. Can you say more? Oh my goodness. So that's a long, so essentially everybody's got their area of special interest, but whichever kidney specialist that you see, I'm sure that they would have the knowledge that's needed to manage and help you out with your particular condition. And if not, if there's someone more specialized, like we have here in Leicester, for example, I see a lot of people on dialysis. My colleagues would see someone with a kidney transplant. Then they would perhaps refer you to those people with more expertise in those areas. But any kidney specialist that you see, I'm sure is going to be exactly what you would need. Thanks, Letty. Nice to see you. That's taken us exactly to 6:30. So I'm going to hand back to Alison, because we've actually got to the end of our questions as well.
Thank you very much, James. An inspiring talk. Thank you so much. And also, likewise, thank you to our audience this evening. This lecture has been recorded. It will be edited and should be available by the end of the week. If you've signed in to receive the link to today's lecture, then you will automatically receive the link to where the recording is. So have a good evening, everybody, and thanks again, James.
Thanks, Alison. Thanks, everybody, and thanks for your comment in the chat. It's been a real pleasure. Enjoy the rest of your evening.